Welcome to our Smartee International Academy webinar. Let me share my screen here. Tonight, we will be discussing about the Smartee Clear Aligner system, products and services, including the Smartee solutions. So we will be discussing about how Smartee Clear Aligner works. So as what Albert mentioned earlier, Smartee is already 20 years in the market, and we have around 76,000 doctors from all over the globe with around 44 plus countries that we support for Smartee, around 830 plus patents as well. And we have a fully automated manufacturing for our Smartee aligners. We have the Smartee automatic production line. And we started from having a single layer sheet and now developed and initiated a triple layer sheet to support a stronger orthodontic force. And these are our manufacturing bases. We have the one from Jiaxing plant and in Ziyang, Sichuan plant and the Madrid, Spain. We also have our own aligner sheet, fully automated production plant. So we produce our own aligner sheet. As for the material, it's a food grade material called PEPG, polyethylene terephthalate glycomodified clear aligner. So if your patient will be asking if it's safe to use, because patients will be wearing that for 20 to 22 hours a day, then we can safely tell them it's a food grade material. Now we will be talking about the Smartee solution designed for mild to severe cases. Smartee solution S1 to S20. S1 is the classic attachment system. So we already have discussed last week what are the purpose or what are the functions of each attachments. So we do have the bite pads attachment, the ovoid attachment, the window attachment, the vertical rectangular attachment, horizontal and intrusion attachment, and precision control. These two attachments, the intrusion and precision control attachments, are patented by Smartee. The intrusion attachment is to intrude the anterior teeth and to prevent the posterior teeth from extrusion, whereas the precision control, that is used to adjust the teeth in angulation to prepare the posterior teeth anchorage and control the root as well. That's for root control. The S2 invisible lip bumper is also patented by Smartee, and that lip bumper is placed on the labial side of the maxillary and mandibular anterior teeth to prevent anterior proclination. Now, that pressure produced by this lip bumper on the lip muscle will be distributed to the posterior teeth to also strengthen the anchorage, especially during distalization. So it also may be used as an alternative to TADS or the mini implant screw and intramaxillary elastic in cases of molar distalization and mandibular advancement. And probably the myofunctional training is also needed. As for the S3 intelligent traction, that is a normal traction system wherein we will be placing a precision cut, and also we will be reserving a cut for the button for you to place on the button. So it is capable of achieving a variety of elastics, including the class 2 elastics, the class 3 elastics, cross elastics, the triangular elastics, couple elastics, suspension elastics, and quadrilateral elastics. So right now, S15 also has a Smartee hook. Later, we will be discussing on another traction system. So this is the normal intelligent traction. S4 is the intelligent power arm and TAD or mini screw. So these are mainly used to close the tooth extraction gap. So the intelligent power arm being closer to the resistance center of the tooth movement, the bodily movement of the canines becomes more accurate and efficient. So as for the power arm, it will be indicated in the treatment plan or in the treatment overview once it is indicated or needed. The S5 Intelligent Rotation Center is using AI algorithm to determine the rotation center and angle for precise control of the rotation center. So it makes accurate tooth movement possible, and it prevents bone fenestration and bone dehiscence due to improper tooth movement. So we are able to adjust the rotation center or the torque. So in this case, as we can see, the stage 0 is one with a thin alveolar bone. Stage 7, if we will see here, there's movement going on, but we are preserving the alveolar bone without having risk of bone cracking or fenestration in stage 28. The S6 classic tooth extraction protocol. It's a personalized anchorage preparation design staging approach with maximum retention of anchorage that provide more accurate tooth movement control in extraction cases. It effectively avoids the roller coaster effect. So that is our classic tooth extraction protocol. S7 is our classic molar distalization protocol. So we are doing the staging method of distalization. I'm sorry. Let me go back to my screen. I think my screen got locked out. Okay, sorry about that. Let us go back to the S7 classic molar distalization protocol. So the staging method of sequential distalization of the teeth is determined. So it also can be used in conjunction with elastics, with lip bumper, or palatal devices to enhance anchorage. So the classic molar distalization protocol means that it's a sequential distalization. Once the canines move at a certain direction, only then will the incisors move, and they move alternately. It's not a simultaneous movement. The S8 device for mandibular advancement has two, SGTB, that's sagittal twin block, or the SGHB, or the sagittal Herbst type. So these are suitable for resolving class 2 malocclusion cases with deep overbite or excessive overjet and deep curve of speed. That's for the SGTB. If your patient has deep overjet but shallow overbite and shallow curve of speed, then the SGHB is indicated. These are for class 2 skeletal cases, malocclusion. S9 mandibular positioning device with bite plane is to create a vertical space for deep overbite to stabilize mandibular position, intrude the lower anterior teeth, and to level the curve of speed. So S9 is more secure and efficient than the bite ramps placed on individual tooths. For S9, we have the anatomical and the non-anatomical bite plane. So the anatomical bite plane has an indentation, and the non-anatomical bite plane is just a smooth bite plane. S10 mandibular repositioning device with occlusal splint is suitable for treating the mandibular deviation and facial retrognatism cases. S11 is a palatal device. We have three types: the clear arch expander, the clear NANS, and the clear TPA. So how do this work? The clear NANS, or the clear arch expander, is of course used for arch expansion and for anchorage enhancement as well. So the clear NANS will assist the distalization of posterior teeth, and the clear TPA will assist with the retraction of the anterior teeth. We also have S12 hybrid therapy, the combination of clear aligners with traditional orthodontic techniques in correction of severe malocclusion. So it's an integration of clear aligner with this, it's like a bracket type. S15 integrated traction device contains two types. One is the Smartee hook, and the other is the Smartee button. The Smartee button utilizes the aerospace riveting process. It's a riveted crystal hook or button that can withstand maximum force, or 3,000 traction force, 3,000 grams, making it applicable for any kind of elastic scenario. For the Smartee hook, that is formed with integrated thermoforming process and is suitable for common elastic methods such as class 1, class 2, or class 3 elastics, or the vertical elastics. S16, the invisible forwarding traction device. That's a combination of the face mask, the S15 Smartee hook or the Smartee button, and the S11 palatal device intended to promote the maxillary growth in facial retrognatism cases with underdeveloped maxilla. Now the S17 is the active mandibular positioning retainer. We normally recommend for patients to use the active mandibular positioning retainer after doing the mandibular repositioning treatment, like the S8 So it maintains the mandibular position after the treatment and preventing relapse of mandibular displacement. So for the active mandibular positioning retainer, we have three types. We have the SGHB type, the one with the hertz type. We have the anatomical biplane type. We also have the combination of both, having both the SGHB and the anatomical biplane type. S18 will be coming up with this soon, is the clear appliance for perioperative orthodontic treatment. So it actually, it's the solution for orthodontic surgery that encompass various steps, such as preoperative orthodontics, intraoperative invisible dental guide plate, and postoperative immediate aligners. We also have S19 for relieving the obstructive sleep apnea syndrome. So we have the mandibular repositioning function to the OSAS treatment field, further expanding the diversified application scenarios of invisible orthodontic technology. So it helps to intervene with OSAS or obstructive sleep apnea syndrome. We also have the S20, the early correction of facial retrognatism phase treatment for the whole duration comprehensive treatment plan. So this is a full cycle phased and remediable comprehensive treatment plan for children and teenagers who have facial retrognatism at an early age. So that includes diagnosis, classification of facial retrognatism, the prediction of the jaw growth, analysis of mandibular morphology, and the application of GS technology, including the S10, S11, S12, S16, and S18. So those are our Smartee solutions. The Smartee treatment for all cases and patient profiles for spacing, cross-bite, open bite, deep overjet, and crowding. We will be discussing about that and which package to choose. We have manufactured over 45 million aligners worldwide to treat these cases. So these are the product series recommendation. We have these product options. GE is our basic product that can treat mild up to complex cases. We also have the daytime and nighttime aligner. It's Smartee Alpha, Smartee GS for mandibular repositioning. And we also have the packages for kids, kinder, and teen. If you will see, we have the Disney IP authorization. We are the first Disney aligner. We are Disney officially licensed aligner company. So we have the IP authorization from Disney, and soon we'll be having the Mickey and the Iron Man products for the Smartee GE. So we have this new look for our packaging. So let us now discuss the products for our adult patients, the Smartee GE, the Smartee Alpha, and the Smartee GS. These are the products for our kids ages 3 to 10 and teenagers ages 3 to 16. So again, this is the Smartee solution. So let us discuss what are the inclusions for the Smartee GE. So we have 4, the Mini, the Light, Express, and Infinity. So we have these features for the software. We're using the Smartee Check. We also have the iFast or root visualization in the animation. We also have our self-measurement, our outcome pre-refinement evaluator, as well as the Smartee Doctor app. So you can use your mobile app so that you can send cases using your phone. We have the Smartee solution S1 to S7, including S15 for the Smartee hook. We have the medical team, 400 plus highly trained smile designers with degree in stomatology. And we also have the acid etching attachment template. So you will be getting also this additional template for the acid etchant. So we have ultra premium materials developed for years, proven by 1,000 or 1 million treatments already, fully automated production. Let's discuss about the Smartee GE first. We have the Mini, which is composed of 10 sets of aligners with 1 free refinement within 1 year. So we're including, if you will notice, we have 3 sets of templates for Mini up to Infinity. So that includes 2 identical composite attachment templates, and we have 1 acid etchant template. We already have upgraded our Mini package to have a set of retainer at the end of the treatment. That is to treat ultra mild case. Now, as for the light package, we have 20 sets of aligners. We already have upgraded that up to two free refinements within 3 years and three refinements. So we have also one set of retainers at the end of the treatment. For Express, we have up to 35 sets of aligners with three free refinements within 3 years and three sets of templates as well. It also comes with two sets of retainers at the end of the treatment. As for Infinity, it's unlimited sets of aligners with unlimited free refinements with 6 years expiration date. So it's upgraded already, and we have two sets of retainers at the end of the treatment. So for Mini, it's ideal for ultra mild case treatment and for aesthetic alignment only. So again, the technology included here is S1 up to S7 and the S15 Smartee hook. So this is an example of a GE Mini case. For the Smartee GE Lite, it's up to 20 sets. And it's ideal for mild cases. For example, if you need to expand the arch, for rotation, for space closure, for if you want to intrude or extrude teeth, and for proclination or crown tipping. So also S1 up to S7 and S15 Smartee hook are included in this Smartee solution. For the Express, it's up to 35 sets. This is for moderate case complexity. And we can treat overbite and overjet with this, crowding or spacing, the crossbite, distalization or mesialization. Again, S1 to S7 and S15 Smartee hook are included in this package. The Smartee GE Infinity is unlimited aligners and refinements within 6 years with two sets of retainers at the end of the treatment. So we can treat moderate to severe class 2 and class 3 malocclusion, teeth extraction, open bite, and molar uprighting, etc. So as you can see, this case can be treated by using just the GE Infinity. Now, we have a second product called Smartee Alpha based on a new generation of human circadian rhythm treatment plan. So we have the daytime and the nighttime aligner. So why did we come up with the nighttime and daytime aligner? Because recent studies have shown that there is a correlation between the growth and remodeling of the condyles as well as the human circadian rhythm or pattern. So the movement of teeth in periodontal tissue during the orthodontic process has the characteristics of the circadian rhythm, as well as the growth and remodeling of condyle. And there's also a certain correlation between the patient's pain and orthodontic treatment. So for the daytime aligner, it speeds up the correction process with stronger mechanical resilience, with stronger encapsulation, and it's super resilient with good tear resistance. Now, the nighttime aligner can provide efficiency compensation to have a stable mechanical control for teeth movement during nighttime. It also has the uniform force, so the orthodontic force is released evenly, which makes the control of complex teeth movement more efficient with excellent controllability. So it makes the treatment 50% faster because we also are incorporating the S11 palatal device and the integrated traction device, the Smartee button and the Smartee hook. So the daytime aligners will provide a comfortable experience during the daytime, and the nighttime generate powerful orthodontic force. So this is S11, the clear maxillary expansion appliance, and the palatal anchorage enhancement appliance. We also have the Smartee button that can withstand all kinds of traction. It's a riveted crystal button that can withstand 3,000 grams max force, orthodontic force, or traction force. So it's based on a specialized treatment plan with AI intelligent nighttime efficiency compensation protocol. So this is an example with the expression of movement 65%. So when we multiply the stage 1, for example, daytime is just about 2-degree movement. When you multiply that with the expression of movement of 65%, it provides you with only 1.3-degree movement and having a 0.7-degree at rest position to achieve this 2-degree movement at stage 1. But when we incorporate the nighttime aligner, we are adding 1 degree So it becomes 3. When you multiply that with 65%, you're getting 1.95-degree movement having a 0.05 resting position. So the resting position is minimal. We are able to achieve the target faster. So that's why it makes it 50% faster result. And we follow the golden ratio rule of having 14 hours daytime wearing and 8 hours nighttime wearing. So it makes it more efficient and more comfortable. There's a better balance between flexibility and controllability, as well as it minimizes the treatment time. So we can also maybe using less refinements with this one. Although the package includes unlimited sets of aligners with unlimited free refinements within 6 years, it comes with 2 sets of retainers at the end of the treatment as well. So it's comfortable daytime treatment and powerful force for faster teeth movement during nighttime with fewer refinements. The technologies included here are also S1 up to S7, but it also includes S11 palatal devices and S15 integrated traction system. The third product that we have is the Smartee GS. This is the one with mandibular repositioning devices. So why did we come up with this? Professor Gang Shen actually cooperated with Smartee with the, that's why it's called GS, is by Professor Gang Shen. So we have the S8 device for mandibular advancement. We have S9 mandibular repositioning device with bite plane. We have the S10 mandibular repositioning device with occlusal stent and the S17 active mandibular positioning retainer. So the moment that the patient insert the aligners, you will already see the improvement with the facial profile. So we are not only correcting the skeletal class 2 cases, but we're also improving the facial profile of the patients. Again, for S8, we have 2 types, the SGTB and the SGHB. So the indication for the SGTB or the sagittal twin block is having 3 depths: deep overjet, deep overbite, and deep curve of SPE, accompanied by flat and horizontally rectangular mandibular body. But for the SGHB or sagittal herpes, that is for mandibular retrusion caused by condylar resorption, mandibular deviation caused by condylar asymmetric resorption, and caused by acrementition. So we have deep overjet or excessive overjet, but shallow overbite and shallow curve of SPE. That is the indication to use the SGHB S8. And this is a sample of an SGTB device. So we have an interlocking device, so it forcibly moves the mandible forward or the jaw forward. So this is the before and after case using the S8 SGTB. So under Smartee GS, we have unlimited sets of aligners with unlimited free refinements within 5 years. It also comes with 2 sets of retainers at the end of the treatment. So we avoid or reduce tooth extraction and surgery when we choose the GS. We also improve the facial profile, correct teeth simultaneously with mandibular repositioning technology. So S1 up to S17 is covered when you choose the Smartee GS. So what are the benefits of having the Smartee GS treatment with mandibular positioning? So we reduce tooth extraction or avoid tooth extraction. We reduce or avoid distalization or high amount of distalization or mesialization of the molars. It opens the respiratory tract. We improve or cure the gummy smile, relieve and treat condylar joint discomfort, and we carry out simultaneously the orthodontic and orthopedic treatment. So it's a two-phase technique. First phase is the orthopedic. We reposition the jaw. And the second phase will be the orthodontic treatment. So this is the best choice when we don't want to do maxillofacial surgery for skeletal class 2 cases, injury or minimal injury correction plan, and to shorten the treatment time and improve correction efficiency. So the Smartee solution for Smartee GS is from S1 up to S17. Just a recap for the product series and technologies. For the Smartee GE, it covers S1 up to S7, including the S15 Smartee hook. But for Smartee Alpha, same thing, S1 up to S7, but it also has S15, both the button and the hook. As for Smartee GS, it covers S1 up to S17. As for the amount of tooth movement in different product series, for the amount of extrusion, you can see here on the table for Smartee GE Mini for light. For Mini, it's less than 1 millimeter, less than 2 millimeters for the light, and less than 3 millimeters for express, and more than 3 millimeters for infinity, and alpha and the GS. That's for extrusion. For translation for buckle, you will see here the values, the translation distal, that translation mesial for the rotation, angulation, root torque, and the change of the aligner. So for the Smartee GE, it's advisable to change the aligners every 10 days. Smartee Alpha, we recommend changing the aligners every 7 days. As for the Smartee GS, for phase 1 for the orthopedic treatment, we recommend changing the aligners every 10 days. The second phase, every 7 days. Now we have the last two products, the Smartee solution for early orthodontic treatment. So if you will notice, Smartee has diverse product options because we want to ensure that we cater to the different age group. Like for Smartee Kinder, it's for ages 3 to 10. The Smartee Teen is for ages 3 to 16. So what's the difference between the Smartee Kinder and the Smartee Teen? Again, we are the Disney officially licensed clear aligner. That's why our packaging also comes with smart Frozen and Spider-Man for teens. Smartee Kinder has 2 years management for ages 3 to 10. It's actually for primary dentition, early mixed dentition, and middle mixed dentition. So here are the common dental problems in occlusal development for kids. So we have this anterior crossbite, we have the posterior individual tooth scissors bite. We also have the upper anterior teeth protrusion, anterior deep overjet. We have the space loss or the primary teeth loss. We also have the posterior crossbite, severe anterior deep overbite, narrow dental arches or dental crowding, and individual tooth ectopia. So according to William R. Prophet, an American orthodontist, he said that malocclusion is not a disease, but defined as a developmental variation of the normal occlusion. So we want to be comprehensive in the treatment plan. That's why we also consider the different factors that contribute to the malocclusion for kids. So these are the interferences during early tooth development. We have the generic factors, the individual, racial evolution, environmental factors, congenital factors, acquired factors, and the functional factors that has to do with breathing, chewing, sucking, swallowing, and pronunciation. That's why we want to address these poor habits or interferences during early tooth development. So for primary dentition, early mixed dentition, and middle mixed dentition, we have these occlusal interferences. We can see cross-bite in patients. And then the myofunctional interferences, the tongue plays a big role with the occlusion or the interferences. So the poor habits like thumb sucking, finger biting, tongue thrusting, these are the poor habits that we also would want to address. That's why we came up with a treatment strategy to prevent and intercept these interferences for primary dentition ages 3 to 6 years old, for the early mixed dentition ages 6 to 8 years old, and for the middle mixed dentition ages 8 to 10 years old. So for these children ages 3 to 10, we have this 2 years management to do prevention and interception. So the Kinder solution is the clear aligner that provides orthodontic force for tooth movement. So this aligner extends to the gum and palatal mucous membrane to enhance the retention. So this feature devices for correcting poor habits of tongue positioning. We also have these myofunctional trainers. We have these silicone products that addresses the malocclusion caused by the myofunctional disorders and improve or strengthen orofacial muscles. So we exert light and continuous force for tooth alignment. It also has the attachment. So we have specially designed attachment for kids with smaller tooth sizes to better express orthodontic force and to help tooth movement more effectively. So the clear aligner has a tongue protrusion. If you will see K3, there's a tongue protrusion here so that the tongue can sit always on top of the palate. So we don't want the tongue to be resting below, so it will help also address any airway or breathing issues. For the tongue crib, it helps also to prevent the tongue thrusting, K3, and we have the special trimming protocol. So the Smartee tongue protrusion is set on upper aligner to guide the tongue to its correct position. So when you will do the scanning for this, the STL file should contain the data of the complete hard palate because it extends up to that area. For the Smartee tongue crib, this pyramidal protrusion is set on the lower aligner to assist and correct poor tongue habits, such as tooth licking, tongue thrusting, and that is placed on the lower 2 to 2 teeth by default. So if you will be scanning, the STL file should contain the data of the hard palate up to 3 to 3 or 4 to 4 or even more. So it comes with the myofunctional trainers as well. So now we will be providing the Joy Joy. We have the Bitey Bitey and the Smiley Smiley. If you will see here, it's a Mickey because it's Disney official license. So we have 3 ways on how to do movement for the Bitey Bitey. For the Joy Joy, it's a specialized treatment used during mixed dentition period to improve the arch form, coordinate jaw relationships, to guide tooth eruption, modify the occlusal plane and occlusal relationship, eventually improve dental and facial development. It also assists in malocclusion treatment, including the deep overbite, deep overjet, and crossbite crowding, etc. So it is just to guide or improve the arch form. The Bitey Bitey works in 3 movements or 3 ways. First is for labial muscle training. Second is for tongue muscle training. And the third is for masseter muscle training. So it is practiced 3 to 5 times per day, around 20 per set, 20 times per set. So for the labial muscle training, the patient is asked to stick out their tongue in this hole. I'm sorry, for the labial muscle training, the patient has to bite on it with their lip, using their lip. As for the tongue muscle training, they have to stick out their tongue on this hole. And for the masseter muscle training, they have to bite on it using their teeth and their lip together. And they practice movement, 20 repeated movements, 20 times per set, and 3 to 5 sets per day. For the Smiley Smiley, it assists in correcting poor habits, including the mouth breathing, the lip biting, and the finger sucking. It also helps to improve early deficiency in labial muscle function with short upper lip or difficulties in keeping lips together at rest. It helps to relieve pressure in perioral muscle. So you have to put it between teeth and lips, close the lips tightly, and then the parents will help to pull it out quickly by hand or with external force. So practice this 20 times per set. The optimized attachments for kids are 40% smaller in size than those for adults. It's for less foreign body sensation, it's more comfortable, and for stronger retention. So this is a case study of a primary dentition with anterior crossbite. Treatment duration was 5 months. Age, the boy is 4 years old. So the main or chief complaint is the anterior crossbite. And the treatment objective was to improve the anterior occlusion. The treatment plan of the doctor was to procline the upper anterior teeth and to expand the upper arch. The solution for this is the clear aligner as well as the Joy Joy. So the pre-treatment and the post-treatment, we can see the improvement in just 5 months. So for kinder, we have unlimited sets of aligners with unlimited free refinements within 2 years. It also comes with 2 sets of retainers at the end of the treatment. That is to do prevention and interception of the interferences, occlusal interferences, the myofunctional, and the poor habits. So the technologies included here is not similar to the Smartee solutions. It has a different solution called K1 to K5. It also can include the S15 or the optional for palatal device, S15 or the Smartee hook. So it's also an option if you want to use the palatal device S11. It's also an optional device, and S16, the forwarding traction device. So K1 is the optimized attachment tailored for children. That's K1 Smartee solution or Smartee Kinder solution. And K3 is the tongue protrusion and tongue crib. We also have the K4, the multifunctional Joy Joy, and the K5 Bitey Bitey and the Smiley Smiley. So the Smartee Teen is 5 years management, and that is for ages 3 to 16 for primary dentition, mixed dentition, and early permanent dentition. So these are the common dental problems that we see in this age group in occlusal development. So we have the anterior crossbite, posterior individual tooth scissors bite, upper anterior teeth protrusion or anterior deep overjet, space loss, posterior crossbite, severe anterior deep overbite with narrow dental arches, or individual tooth ectopia, but we can also see already the facial prognatism with this age group. So the treatment strategy, apart from doing prevention and interception for the interferences, we can also do guidance and correction for abnormal dental replacement and mixed dentition and the abnormal development of maxilla and mandible. So we have the Smartee Teen solution. We have the clear aligner for dentition correction and mandibular repositioning. We have the myofunctional trainers as well for labial muscle, for the tongue muscle, and the masseter muscle training. We also have an optional functional appliance for arch expansion and for space maintenance. So these are the solutions. We have the K3, also the tongue protrusion. We have the tongue crib. Now, it's an option if ever that your patients don't have these kinds of habits, then we can opt not to have this. So you can actually set that in the prescription page. Now, the aligners trimming protocol, we also have that. We can extend that for retention. We also have the mandibular repositioning solution. So the S8, S9, S10, S11, S16 are included in the Smartee Teen package, as well as the Smartee hook and the Smartee button, the traction system. So similar to the Smartee Kinder, we have also the Smartee tongue protrusion and the Smartee tongue crib. It has the S8 mandibular advancement, SGTB, or the sagittal twin block, again to treat the 3 depths, deep curve of speed, deep overbite, and deep overjet. SGHB, the sagittal herbs, is only for 1 depth for excessive overjet or deep overjet, but shallow curve of speed and shallow overbite. S9 bite plane, and the S10 occlusal split. So the S9 bite plane actually is to treat deep overbite for straight profile patients, patients with straight profile. So S8 mandibular advancement. When we submit for this case, we need to submit the original bite as well as the repositioned bite and photo. So we will be discussing that on our next course on how to submit a case. For the S9 bite plane is to create a vertical space for deep overbite and to stabilize mandibular position, to intrude the lower anterior teeth, and to level the curve of speed. For the S10 occlusal splint, it's suitable for treating the mandibular deviation and for facial retrognatism cases. So the palatal device is also optional for the Smartee Teen package. We have the clear arch expander, we have the clear NANS, and the clear TPA. The S15 integrated traction device is also included in the teen package. The Smartee button is adjustable in multiple directions with 1.5 times higher efficiency than the traditional buttons. I'm sorry, this is the Smartee hook. The left side is the Smartee hook, and this is the Smartee button. So the Smartee button supports the traction forces in all directions. It's a riveted crystal button. The invisible forwarding traction device, S16, it's S15 Smartee hook and S11 palatal device with combination of the face mask. That's intended to promote the maxillary growth in facial retrognatism cases with underdeveloped maxilla. So it also comes with the multifunctional trainers, the Joy Joy, the Bitey Bitey, and the Smiley Smiley. And if ever your patient would be needing these functional appliances, the removable palatal expander, the general type for the upper arch or the lower arch, the removable one, you can actually, we can order that from Smartee. It can come with a treatment plan, unilateral space maintainer or the TPA for impacted ectopic tooth traction device. So these are optional functional devices for the Smartee Teen package. So 5 years management, unlimited stages for Smartee Teen with unlimited refinements within 5 years. And it comes with free retainers at the end of the treatment. So these are the indications to treat the Smartee Teen for anterior crossbite, facial prognathism. The treatment objective is to have a class 1 molar relationship and improve facial profile. We can treat that. Space management and abnormal teeth eruption to align dentition and to improve dental space, improve arch form. So these are the treatment objectives and the indications. The Smartee Teen solution, if you will notice, have more solutions, K1 up to S16. And there's an option also to provide these functional appliances to our patients. So this is a case study of a 14-year-old boy with treatment duration of 33 months. Again, compliance is a must. Patients have to be compliant in wearing the aligners at least 20 to 22 hours a day. So chief complaint of this patient is facial prognathism with crowding. And the treatment objective is to have a natural facial profile in even midline and class 1. So the treatment solution was the SGTB or the sagittal twin block, S8. So this is before the treatment, and this is what it looks like after the treatment. So for Smartee Teen, it's also unlimited sets of aligners with unlimited free refinements within 5 years. So we can pause 2 times within 5 years. It comes with 2 sets of retainers to do prevention and interception, guidance, and correction. So there's optional technologies for S11, the palatal device, and S16, the integrated, the forwarding traction device. That's also optional technologies. So here are the inclusions. So primary dentition, early mixed dentition, for middle mixed dentition, late mixed dentition, and the early permanent dentition. So these are the differences between kinder and teen indications. So as for teen, we already treat the facial prognathism to make it a class 1 molar relationship and to improve facial profile. So for kinder, it's just prevention and interception with 2 years management. And as for teen, it's also guidance and correction as well. In correcting also the facial profile of your patient. So these are the differences, different Smartee solution for kinder and teen. The Smartee product series, K1 to K5, and K1 up to S16 for teen. So we have a unique medical team. Whenever we submit a case, we have 400 plus mile designers, highly trained with degree in stomatology, headed by Dr. Wu Gang. We also have a research and development team for Smartee GS, headed by Professor Gang Shen's orthodontic team. And we also have the R&D team for Smartee Kinder and Smartee Teen. So we are backed up by all the orthodontic professionals. We hold academic events in different countries. And Professor Gang Shen is also doing conferences for the Smartee GS. So we already held different academic events in different countries for the Smartee GS Mandibular Repositioning Technology conferences. So we're high with academic marketing, and rest assured that Smartee's team will back you up with all your cases. So that's it for today, for tonight. Thank you so much for watching, everyone. Thank